oil on a car or truck? Hold up your hand. Great, okay. How many of you in here, in that process, spilled oil on the driveway? Okay, so my question is, what do you do to clean up the mess?
Cat litter.
Kitty litter. Anything else? If you don't have the cat, sawdust, right? Okay, so VID00003 Purify is a detoxification product. It's a detoxification system. There's a lot of detox methods out there. You've got something that's very, very distinguished in the marketplace. This is something that is gentle, effective, and deep. D-E-E-P, deep. What I mean by deep is, I could give you all, or I could take myself, and doctors do this to patients commonly right before colonoscopy, a quart or 2 or 3 of a solution to drink, and it would completely purge your gastrointestinal tract system in less than 24 hours. That is a type of cleanse. And when the doctor puts his fiber optic telescope up inside me, it's spotless. That's not deep. That's very superficial. And as Dan showed you the numbers of these bioaccumulates, the take-home point of that is almost all of those dangerous chemicals are oil soluble. They're fat soluble. When they're ingested, they go into the body, and the body stores them in very, very thick fat tissue that we call hibernation fat. And as they accumulate, the body goes, gosh, this stuff is toxic. Let me absorb other things to dilute them out because I can't get them out of my body. And so that leads to the midsection spread. It leads to hormone dysregulation. It leads to poisoning of the interior of the cells. So we have to reverse that process. We have to actually dredge these toxic oil-soluble chemicals out of the cells, bring them into the circulation, take them to the oil filter of the body. Now, those of you all that have done oil changes on your car or truck, you always change the oil filter, didn't you? Right? Well, to do an oil change on the human body, if we change the oil filter, we call that a kidney transplant. Excuse me, a liver transplant. Okay? So the herbs in this formulation, they saponify, they act like an oil-based soap at many, many different tissue levels, so that it actually eases the egress of these oil-based toxins from the cell, through the cell membrane, to the lymph, to the blood, through the blood, to the oil filter, which is the liver, to the gallbladder, which then ejects it into the gastrointestinal tract, where the sawdust or the kitty litter is waiting to receive that stuff and bind it. Where this toxic waste dumps into the gastrointestinal tract is 4 feet down a 24-foot pipe. And if I were to smear toxic oil on my skin, the skin would just drink it up and it would glow in my bloodstream. If I smear toxic oil on the interior of my intestines, it gets drunk up also, unless I have a binding resin in there. So the fiber component in this is very, very essential. The oleation, the oil, is very, very essential. Now, when we do an oil change on a truck or a car, we empty out all the oil, and we take off the oil filter. As I said, we can't take the oil filter off the human body. That's a liver transplant. And when we do that oil change on the car, we see that that oil is really, really ugly, isn't it? It deserves to be bound up with some kitty liver or some sawdust. So when this stuff comes out of the body at mile marker 4 feet and has another 18 feet to go, it needs to be bound. It'll be bound by the fiber. And the oil that we put in, we can't put an extremely heavyweight oil in. So the particular plant seeds that we've chosen are seeds that are very light to slightly medium weight in oil, weight, and viscosity. They're very, very gently warming, so they actually help solubilize things. And there's a couple of them, the evening primrose oil and the borage oil, which have very, very specific effects to balance oils that circulate freely in our blood that have very, very warming and cooling effects on our physiology, and we call those hormones. So 51% of the people in this room, the women in this room, know what rancid hormones feels like. It's hot flashes, or it's emotional irritabilities, it's all the symptoms of premenstrual syndrome. Men, you have that too, but because it doesn't happen cyclically on a monthly cycle, you don't know about it. Your wife or girlfriend starts complaining about your irritability, and you think you're just going through a normal routine, but you're actually going through an overheating of the oils, and so you're having a hormonal fire, a hormonal flare. So the fiber is important, the oil is important, and then the AM and PM blend. Let's talk about the AM blend. In addition to these herbs, we've added a couple of very specific, what I call Cadillac nutrients. Nutrients are vitamins, minerals, amino acids, but we've gone through that whole realm of Western biochemical nutrition and chosen some very, very, very specific Cadillac nutrients in order to affect the same deep cleaning. You all have heard about antioxidants, right? Okay. So antioxidants, vitamin C, vitamin A, vitamin E, I mean, there are a myriad of those. There is one antioxidant that is both water and oil soluble. Water and oil doesn't really mix, does it? That's why we shake up the olive oil and vinegar right before we pour it on the salad dressing. But curiously, there is one antioxidant produced in the human body that gets used up as a very, very valuable commodity, and it's called alpha-lipoic acid. And that's the antioxidant in the AM blend. In addition to that, there is calcium deglucarate, which helps the liver decide whether a toxic molecule coming to the oil filter is going to either go into the urine or go into the stool. The water-based excreta of the body or the oil-soluble excreta of the body. And then also N-acetylcysteine, which helps remove heavy metals from the body and also energizes the liver. And then something called inositol, which is an emulsifying agent. It's something that you can add to a water and alcohol system to make everything blend together. So, who can purify? All adults, kids over the age of 16, individuals with medical conditions with medical permission. Why do I say this? Well, let's look down the bottom. Individuals on medications, there are interactions between some of the herbs and some medications. We won't go into that very much today, but fundamentally, anyone who's under the care of a physician, have the patient show the kit to the physician and get their permission. It'll just make your life a lot easier. Pregnant and lactating women should not undergo a cleanse because it will bring the oils into the bloodstream, and those oils can get transported across the placenta into the developing child and intoxicate them with those toxins. Common detox symptoms are nausea, fatigue, lightheadedness, headaches, an unusual taste in the mouth. As these waste products circulate in the bloodstream, we can actually taste them. A body odor as they start coming out in the sweat. Some bloating, gas, or constipation as that toxic oil is released into the intestines, and it may not be 110% bound by the fiber, or there may be an imbalance between the fiber and the oil. And then skin rashes or itching. By and large, all of these things can be managed by an individual increasing their hydration or slowing the process down. Now, what hydrates the human body is not water. What hydrates the human body is salt water, okay? If I were staked out in the desert for 3 days and then taken to the emergency room, they would not put water in my veins, they would put salt water in my veins. So, how much water should someone ideally drink? Well, right now in our culture, a lot of people are drinking a lot of coffee, a lot of green tea, a lot of black tea, a lot of carbonated beverages with or without caffeine. All of those things dehydrate the human body. So a large percentage of our population is chronically dehydrated. They start this cleanse and the dehydration will be unmasked. It will become more prominent. So what I recommend is that you ask the person to take their body weight, divide it in half, and that number becomes the number of ounces of water plus a little tiny pinch of sea salt. Not much, but just a pinch of sea salt, and that they drink that on a daily basis. So if I weigh 150 pounds, half of that would be 75 ounces of water with pinches of sea salt, sipped throughout the day, not iced, room temperature or slightly warm. So what to do about these? Drink more water. The second thing is they can increase their amount of cooked, gently cooked or steamed vegetables and gently boiled whole grains, not whole grain bread. Remember, flour plus water from kindergarten makes paste. And we actually want to remove some of the plaque and tartar that's built up in the body, right? So we're going to have a gentle scrubbing up action. The other thing is to open up the pores of the skin. You can do that through what we call therapeutic baths. Taking a bath where you throw some bath salts in there, maybe you actually put a couple of drops of an essential oil, light a few candles, really relax, and get some sweating into the bath water. Now, you can increase the effectiveness of your therapeutic bath by dry brushing the skin or exfoliating the skin so that the pores are open before you get in. Get a natural bristle brush and brush from the fingertips towards the heart, from the tips of the toe towards the heart, until your skin is kind of a little bit tingly, and then get into the bath. So here's my prescription. For new people coming into your system, have them purify 1 week, a month, for 3 months. After they do that, the effectiveness of Achieve, Excel, and Amalaki will be much, much, much more powerful than if they just started using it on their own. Now, some people like to shop, some people like to make their own choices rather than follow my recommendation or your recommendation. So it's perfectly fine to have them begin with any of the products, the Achieve, the Excel, or the Amalaki, but have a clear sense on at least a very, very fundamental level of what the performance is of those 3 products. So Achieve, anyone with midsection spread can begin there. With Excel, anyone who wants to energize their cellular metabolism or energize their digestion. And those are two, this is energizing cellular metabolism would be people that want to, that are athletes, okay? People that have a sluggish digestion, they'll tell you that. And the Amalaki works really, really well initially for people with aches and pains or who are under excessive amounts of stress, or you can just look at the wrinkles in their face and know that they'll benefit from that. So 2 different ways of bringing people into the universe.
All right, so thank you, Dr. Tom. Great info there, right? Unfortunately, we have about 10 minutes now.